In this episode of Ask Dr. Zach,
I have chronic back pain, it's lingering. Just bending down in the kitchen to get under the counter, say to put garbage away or something, it hurts my back. It's debilitating, and it's a question of quality of life.
And later,
No, it's a coughing here. I have short breath. You have to do like this to get some air. You don't feel comfortable.
then on the doctor's orders,
Don't believe the medical myths. Now, there are lots of medical myths. Don't believe them all. In the ER, I deal with trauma and life-threatening situations every day. I've seen it all. I know firsthand that accurate medical advice can save lives. I'm Dr. Zach, and I'm passionate about empowering people to take control of their own health. This is your chance to ask me health questions. No question too big, no question too small. Our topic today is the spine, which provides the main support for the body, allowing us to stand upright, bend, and twist. The spine is made up of 33 individual bones stacked one on top of the other, and they're connected by ligaments and muscles. Protected deep inside the bones, the spinal cord connects your brain to the rest of your body, allowing movement of your arms and legs. Keeping your spine healthy is vital if you want to live an active life without back pain. To learn more, let's look at the Blazon medical animation.
The spine is a column of bones that forms the axial skeleton. This framework provides strong, yet flexible support for the trunk of the body, as well as protection for the delicate spinal cord housed within it. The spine consists of 33 vertebrae stacked vertically upon each other. The vertebrae are connected by facet joints at the back of the spine. These joints allow movement between the bones of the spine. The vertebrae are stabilized by ligaments, and most importantly, are separated by an intervertebral disc between each vertebra, which functions as a shock absorber. The vertebrae can be classified into 5 segments. These segments include 7 cervical vertebrae, 12 thoracic vertebrae, 5 lumbar vertebrae, 5 fused sacral vertebrae, and 4 fused coccygeal vertebrae.
And we'll be right back with much more about the spine.
up next,
Just bending down in the kitchen to get under the counter, say to put garbage away or something, it hurts my back. It's debilitating, and it's a question of quality of life.
all this and more right after this short break.
You know, just bending down in the kitchen to get under the counter, say to put garbage away or something, it hurts my back. I'm sort of an encyclopedia of health problems. I got diabetes many years ago. I'm type 2 diabetic. I developed sciatica. I have chronic back pain. It's lingering. I've had cancer, squamous cell carcinoma. And more recently, I had an accident on my scooter and I cracked my C1 cervical vertebrae. It's debilitating, and it's a question of quality of life. Well, here's my handy-dandy walker, which I selected out of a large choice of different designs and sizes and makes. Somehow it eluded me at the beginning, and I just suffered ignobly, but eventually I cottoned on to the availability of these walkers and got one. It's hard to be physically active. If I have to stand up, I'm soon looking for a place to sit down. I go 3 days a week to the gym where I have an instructor. Most of it is stretching and some of it is strength building. You got to keep your shoulders in and you raise it like this and then down. I try and do stretching exercises here at home on the days that I'm not going to the gym. I'd like to ask Dr. Zach what he is familiar with in the way of curing chronic back pain.
Now it's time to ask Dr. Zach.
Welcome, Mel.
Well, pleasure to be here.
Well, we're glad to have you. So it sounds like we have a lot to talk about, so that's great.
Yeah.
And we can talk about a lot of things. Let's start with the back. since that's sort of our focus, but we can talk about other things as well. So I just want to start by asking you for two things. One is, how long has it been going on? And two is, have you been given a diagnosis for a cause for this chronic back pain?
So it might have been 3 or 4 years ago, but it started up actually while I was on a cruise ship. And I was walking into the dining room and all of a sudden, bang, I just couldn't take another step. The pain was excruciating. I was immobilized. And, you know, they got me a wheelchair and I managed to hobble around a bit, and I went to their health club and did some exercises, but they right away said it looked like sciatic, like sciatic nerve. Thanks to the MRIs I got immediately in the States, and which takes 2 to 4 months to get in Canada, I was diagnosed with, I forget the proper nomenclature, but it's the S1, something S1, the lowest
L5
lumbar.
Right. L5S1.
L5S1, that's exactly right. And it was compressed and bulging. And it's the bulging part that presses on the nerve.
Was that a
the
disc?
Sciatic nerve, the disc.
The disc,
The disc. The vertebrae are the vertebrae, but it's the discs that are interfering with the nerve. And one of them is the sciatic nerve, which you feel it not in your back. I'll get to that.
Yeah.
You feel it in your glute.
Yeah.
And it's a horrible pain. But then it travels down your leg and into your foot. And that's the nerve that allows you to walk. You know, otherwise I'd kill it.
Yeah.
I've been going to physiotherapists, and now I'm at a gym and I'm doing stretching exercises at the gym, and I'm soon starting with a chiropractor. I'm hopeful that eventually, but the problem really is I'm lazy and unmotivated. I hate exercising. I go every second day to the gym where I've got this wonderful trainer, a young lady who really knows her stuff, and she can tell just looking at me whether my shoulder's too high or my muscle isn't grabbing enough, you know, whatever. And she's good. But so far, the lower back pain is always there. And what it does to my lifestyle is I have trouble standing or walking for a long time. And I must tell you, painkillers, I'm totally opposed to them. I try to avoid them. I think pills like that are bad for your health overall, and they have side effects which I didn't appreciate, so I try to avoid them.
I mean, the good part is, one of the things I wasn't sure from the video was, you know, do you have a clear diagnosis? It sounds like you do. You've had a number of MRIs. Problem is, you know, one of the problems I see here is that you are doing the right things, and there is a finite number of options available. So number one is the exercise, for sure, which you're doing, although maybe moderately. I mean, there's no way around it, unfortunately. And the more you do it, the more you get out of it. It's nice if you can find something that you don't hate doing. You know, it's nice that if it's not a chore, for sure. The second thing is medications, which I hear you.
Oh no,
You're
no
not
medications, no.
Okay, and I mean, to a certain extent, they're Band-Aid solutions, but sometimes they give people enough relief that they can do the exercise.
The side effects are worse than the pain, as far as I'm concerned.
And then it gets to the actual treatments. So either there are a number of different treatments. What about, so you mentioned the surgical treatments, or the minimally invasive, which really is the future, I think. Most surgeries are going minimally invasive.
You have to be accepted as a candidate for surgery, which makes sense. Yeah. I mean, not everyone. I went to an advanced chiropractor who works out of Trillium, a nice guy. He feels my pain is more mechanical, more to do with bones than nerves, which I find strange. But he says his job is to forward people on after examining them for surgery. Yeah. He says, but only 10% of the people who are referred to him are considered a candidate for surgery. Yeah. The candidacy is based on whether there's a likelihood of a major improvement, right? Otherwise, it's a waste of time and money.
Absolutely, and people, by the way,
and I'm not
get
a candidate.
Worse sometimes, eh?
Yeah,
you've seen the failed backs sometimes? What they call the failed backs are people who've had surgery and they're actually worse afterwards. So it's certainly not something you want to get into.
There's a risk. I'm on a waiting list right now for an MRI because I feel my spine has gotten worse, not better. And it takes 2 to 4 months. It's been 2 months now. I'm still waiting. I went to see this advanced chiropractor who could have ordered up an MRI. He didn't want to do it. In the States, if your doctor feels you need an MRI, you can go right in the next day to Simon Med, a private lab. It costs next to nothing. They're so cheap.
Now, Dr. Zach's prognosis.
Mel came in complaining of back pain, chronic back pain, for which he's had lots of tests and he's looked into some pretty expensive therapies. But he really answered his own question. He said he doesn't like to exercise. He needs to exercise. There's no getting around it. That's a lot cheaper than the surgeries he's looking into. It's a lot cheaper than all the MRIs, a lot cheaper than everything. He needs to motivate himself to exercise. He'll get his strength up, he'll get his flexibility improved, and he'll feel better.
Now it's time to ask Dr. Zach about abnormal heart rhythm known as arrhythmia.
During an arrhythmia, the heart can begin to beat too fast, too slow, or with an irregular rhythm. These irregularities could cause lack of blood flow, which can damage the brain, heart, and other organs. To learn more about the heart and arrhythmias, let's take a look at this Blazen medical animation.
The body requires oxygen to carry on the process of life. A network of arteries and veins transport oxygen-rich blood to the body and return oxygen-poor blood to the lungs. At the center of this continuous process is the heart, a beating muscle about the size of your fist. The heart pumps approximately 5 quarts of blood every minute, and each heartbeat circulates blood to both the lungs and the body. This is possible because of the heart's complex internal structure. The heart is divided into the right side and the left side. The right side comprises the right atrium and right ventricle. These chambers collect oxygen-poor blood and pump it to the lungs, where oxygen is replenished. The left side of the heart comprises the left atrium and left ventricle. These chambers collect and pump the oxygen-rich blood to the body.
We'll be right back with much more on heart arrhythmias.
Still ahead,
No, it's a coughing here. I have short breath, so you have to do like this to get some air.
don't get your blood pressure up. We'll be right back.
No, it's a coughing here. I have short breath, maybe 2 or 3 years now. I guess my heart sometimes beating not regular. The short of breath is always happen when I walk too fast, when I did something in a hurry, then I have short breath.
Smells good.
You don't feel comfortable. You have to do like this to get some air. Recently, I have happened a lot, but maybe few times in a day, maybe every few hours, and maybe sometimes every hour.
And there's the yellow flower.
Because my father died of heart attack, so I was thinking, would it be related to that? I have 3 children. They watch me very carefully. If I have that kind of problem, it won't stop me. I joined the Active Fitness. I joined the Bridge Club. I'm learning right now. I'm just kindergarten right now, okay? I like to walk on the harbor front. It's beautiful there. I'm still doing what I'm going to do, but maybe slowly.
This is nice.
I hope the doctor will help me or will tell me something I can avoid or do something to make me feel better.
Now it's time to ask Dr. Zach.
Welcome, Monica.
Thank you, doctor.
Well, thank you very much for being here. So, we're going to talk about palpitations today, and I understand you've had them. Is that right?
Right.
When did that start?
I guess it's in 1999 started that.
So it's been a while, yeah.
Yes.
What does it feel like to you? How do you know that you have them?
Okay, I can feel my heartbeat sometimes fast. And then, of course, you don't feel comfortable.
Yes.
And sometimes we gave you some disease.
Yeah.
And sometimes kind of you feel the heart, the head is very heavy.
Yeah. And you said you feel dizziness also when it comes on?
Yes.
Yeah, okay. People who don't know, palpitations basically is exactly what you said. You feel your heart beating. Usually it's beating all the time and we don't feel it. So
Right.
it's that you feel your heart beating, and often it feels sort of violent or uncomfortable. Sometimes
Right.
it's just once in a while, and some people get it a lot. Does it happen every day or just occasionally?
Not every day. No.
Not every day, okay.
No.
And I assume you've had some investigations to see what's causing it?
Yes, my family doctor gave me the Holter test.
Holter, yep.
And I tried it 2 times. The
Okay.
first time is just 1 day.
Yes.
I mean, one night or what, and didn't show.
Right.
And then afterwards, he gave me 3 days.
Yes.
But still didn't show. But I can feel the heartbeat.
So you had it, when you had it on, did you have the palpitations?
Yes.
Oh, you did? Okay.
Yes.
That's actually a good thing. Now, but there are some things that you have to worry about. Now, and one of the things that we worry about palpitations more, is if it's associated with dizziness, which is the case in your case. So that makes it a little more concerning. On the other hand, and so what do? The workup consists of a history and physical, finding out what brings it on and what's associated with it, and then tests like blood tests. I assume over the past few years you've had some blood tests.
Yes.
An electrocardiogram. But the problem with an electrocardiogram, it's just that 1 second, it's just that 5 seconds you know when it's going, so it's a picture. The Holter monitor measures your heartbeat for 24 hours.
Yeah.
But again, if you're not having it every single day, you can miss it. Are they getting worse for you?
Not getting worse, but it makes me short of breath, I think.
It does, eh?
Yeah.
Yeah. If you hadn't had it looked into already, because you have a couple of the symptoms that always make doctors nervous, especially with respect to palpitations. So, because the reason is, if you're dizzy or lightheaded, it can mean that you're not getting enough blood supply to the brain. So we worry that your palpitations are from an arrhythmia, like a bad irregular heartbeat. The other thing is shortness of breath. We worry about also because it can be related to the heart as well. So if you're either really bothered by it and that it's persistent, you can always go into the hospital. You go to the ER if you're really worried, or if it's still persisting, it's still bothering you, still talk to your doctor, because maybe there is another cause. Maybe it's dietary, maybe it's one of the medications you're taking, maybe it's just something that can be changed. It'll just improve your quality of life.
I see. Would it make my hand shake?
Well, it can sometimes if it's violent enough.
It's coming for 2 weeks, I guess. And now my hand is start to shake.
Oh, really? Eh?
Yeah.
Well, and that's new, eh?
Yes.
That's new. So that would be a reason why I think it would be important to get in to see your doctor.
Oh.
Okay?
Okay.
Give him a call, or her.
Him.
Now, Dr. Zach's prognosis.
Monica came in complaining of shortness of breath and also chronic cough. The shortness of breath was a little bit concerning because it was associated with upper back pain. Now that can be an atypical sign of heart disease in women, so that's something she needs to get checked out. Now, as for the chronic cough, it could be one of the 3 primary causes, those being asthma, gastroesophageal reflux disease, or postnasal drip. She needs to follow up with her doctor about both of those things.
Don't go far. We'll be right back with the doctor's orders.
Doctor's orders, don't believe the medical myths. Number 1, you can swim after you eat. You might get a cramp, that's the worst that can happen, then take a rest. Number 2, you don't need at least 8 glasses of water a day. It depends. If it's really hot out, if you're exercising, then you need more water. If you're thirsty, drink more water. But there's no magic 8 in the number of glasses that you have to drink. Now, there are lots of medical myths. Don't believe them all.
Now it's time for you to ask Dr. Zach.
First question, please.
Yes, hi, Dr. Zach. I wanted to ask you about a hernia that I had, or I have. I guess it's called the one in the middle here is a hiatal, is it?
Yeah, hiatus hernia.
And what's the odds of, or the success rate of repairing it?
The success rate of the surgery, and the good thing about the surgery is they can do it endoscopically. They don't have to do a big cut anymore. They can do with small cuts and the cameras. The success rate is very good, so we're talking about near 100% success. However, the recurrence rate, so that's always interesting, like how often. The recurrence rate is about 4%. So it's not high, and again, because it's a laparoscopic surgery, it's not a terrible ordeal to go through, and you don't necessarily have to stay in the hospital. But it's still a surgery, there's still potential complications. They used to just do 1 or 2 things laparoscopically, and now it's become standard for elective surgeries for things like the gallbladder. They're doing some spine surgeries now endoscopically.
Who specializes in that?
But basically it's general surgeons who do that kind of surgery, and there are some general surgeons who specialize in doing things in a minimally invasive way, endoscopically. Thanks for the question. Next question, please.
Hi, Dr. Zach. I had a Morton's neuroma surgically removed 2 years ago, but it was never fully explained what caused it or how to prevent a recurrence.
Okay, good. So Morton's neuroma, as you know, and some people don't, it's a buildup of some of the soft tissue on the foot, usually between the third and the fourth toes, around the area of the nerve, and it can get quite painful. And usually people describe it sometimes as having like a rock in their shoe constantly that's always pushing between the two toes.
Right.
Anyway, so the question you had is, what you can do to prevent recurrence. And actually, it's much more common in women, actually. So in women, not you, I always say, stop with the high heels. I'm not a fan of the high heels. And high heels are one of the biggest causes of it. Other causes of it that may be more applicable to you, obviously, would be tight shoes, and high impact sports can put you at increased risk for it. So what can you do? If you do have tight shoes, so now you're not, I can see your shoes, you're wearing running shoes. Those are good, they're supportive, they have good cushioning. People who wear shoes like mountain climbing shoes, those are the types of shoes that are known to be somewhat potentially a problem with Morton's neuroma.
Okay.
Aside from that, some people find that getting an insole helps, or even a foot pad in the front that gives them a little more cushioning. And then if you find, the other thing is trying to find a trigger in terms of what brings on the pain. So try and find the trigger. And even if you want to continue to do that though, at least you know the trigger, you can work with your doctor on ways to prevent the pain associated with it.
Okay. Thanks.
Thank you. That's all the time that we have for today. Thank you for watching, and be sure to join us next time on Ask Dr. Zach.